Ayan. May aeroplano. Hi, my name is Vince Leonard Yabut. I'm an internist, subspecializes on medical nutrition. I had my med school on UST and graduated in Makati Medical Center in my residency and finished my fellowship program at St. Luke's Medical Center. My hobbies are, to be honest, lumaki ako sa part na dumadami yung PC games that time. No? So, yung mga PC games ngayon, nalipat na sa mobile games. So, part of my hobby is playing mobile games. Now, next would be what are my favorite things. If dating my wife is a thing, if spending with my baby boys is a thing, those are my favorite things in the whole wide world. So, motto in life. So, with that, labas ko lang yung one of my favorite verses sa Bible. So, sabi dito in Proverbs chapter 3 verses 5 to 6, trust in the Lord with all your heart and do not lean on your own understanding. In all your ways, acknowledge Him and He will make straight your paths. To trust and to believe and to lean kung ano yung gusto ni Lord sa buhay ko. So what are the top 5 diseases in medical nutrition? So first of all, nandyan yung undernutrition or malnutrition. So ibig sabihin yan, pag sinabing undernutrition, yung daily needs ng pasyente, may it be sa outside or inside the hospital, hindi nami-meet in a long period of time, leading to profound weakness, muscle loss. Of course, nandyan yung maapektuhan din yung immune system. Sadly, it also affects yung kanilang performance and not just that, yung kanilang long-term functionality. So secondly, meron tayong tinatawag na sarcopenia. Sabi sarcopenia, sarco means muscle, penia means loss. So nangyari niyan, so in short term, yung muscle natin sa pasyente nawawala. And as we all know, with muscle, ito yung main function nito is to move, for you to lift, for you to walk. So, ang symptoms niyan, yung patient sobrang weak, hindi nila makatayo from the bed, hindi makalakad ng maayos. And kadalasan nakikita yan sa ating mga elderly o older adult patients. And with that, you can see that na it's also a complication ng malnutrition. If an elderly patient or even a patient sa hospital was not able to eat what he needs or she needs every day, yung muscle niya, niliit rin yan. And makita mo yung mga pasyente pag uuwi na, sobrang weak, mahina po yung katawan at di makatayo. So third, meron tayong tinatawag na wasting diseases. No? It's also like sarcopenia, but because of meron tayong malalang disease na mataas yung inflammation, nangyayari niyan sobrang payat ng ating mga pasyente. Tulad nito, yung mga cancer patients natin, yung mga TB or mga pulmonary tuberculosis na patient, even po yung mga patients na may CKD or chronic kidney disease na hindi napapabayaan yung nutrition, and also yung mga tipong after the operation hindi kumakain, sobrang payat po nila. So all of these are sarcopenia plus yung mismong sakit nila na hindi gumagaling, like yung cancer nga na continuously meron tayong anti-cancer therapy but hindi nabibigyan pansin yung nutrition. Sobrang umihina rin sila, sobrang nanghihina sila, sobra silang hindi lumalakas, at of course yung inyong kanilang immune system is also affected. A portion of my patients are obesity or overweight, and as we all know, obesity has been termed as a chronic disease already, katulad niya ng hypertension, diabetes, and other communicable diseases. Now, of course, in comparison with malnutrition, kabaligtaran naman to, it's more of excess. May it be behavioral habit or may it be na sila mismo meron silang parang tendency to with the metabolism mabilis tumaba. Sadly, kailangan to makontrol because being obese has a risk for you to have more diseases like diabetes, hypertension, stroke, and even those cardiac diseases. And the management would be, if we're able to decrease the weight or the weight of the patient around 5 to 10% in 6 months, lahat ng nasabi ko kanina, bababa rin yung risk factor niyan. And of course, in one particular notion dyan, there's no one diet fits all. Different types of obese patient, different types of overweight patient has different types of also needs na dapat mapunan, mabigyan ng pansin, not just give them anything that they na nakikita sa internet. So in short, kailangan meron tayong individualized nutrition weight management sa bawat obese patient. Fifth type of patients na needing medical nutrition are ICU patients. Kasi to be honest, this patient has the higher risk to develop malnutrition during their ICU stay. Yan yung mga yan na yung sakit nila grabe, mataas yung inflammatory factors, may naka-NGT, however the NGT was not, puro lang to blenderize na hindi po sakto yung nabibigay sa kanila. And same thing, sobrang dami nangyayari sa kanila to the point na yung kanilang metabolism are sobrang taas. And they needed the right amount of nutrition per stage in the ICU. May it be pagdating sa ICU, dapat mababa lang. Tapos eventually, pag gumagaling, pag tumataas yung, even pag tumataas din po yung blood sugar, kailangan may tama po siyang right nutrients on that particular period. And study shows that would tell us na an ICU patient can lose 1 kilo of muscle mass in every day. So, mapansin niyan, sabi sa studies, around 50% of the muscle mass can be loose or can be mawala in the 10-day period. Tapos, after sa ICU, nasa ward, nakauwi, going back sa sarcopenia, mahina naman sila, walang lakas, hindi makatayo, which is sadly, dapat mabigyan agad ng tamang nutrition management upon admission sa ICU.